Hello, hi, good afternoon. My name is Mr. Khoo. I'm the consultant urologist attached to Island Hospital. What I'm going to give you today is a talk on urinary tract infections in men and women. Okay, now, urinary tract infections is actually one of the commonest infections in human body, and basically it accounts for most or a lot of visits to outpatients clinics and also emergency departments. So what do we understand by urinary tract infections? Now basically when we talk about urinary tract infections, it means infections in any part of your urinary tract system. So if you look at this diagram, this is the urinary tract systems, consists of kidney, ureter, bladder, and also urethra. So we talk about urinary tract infections. It can happen in kidney, it can happen in ureters, bladder, and also urethra. Why is it important to know all this? Because we need to know where the infection happens, and we need to tailor the management according to site of the infection. So sometimes infection can be very simple, uncomplicated infections. Sometimes it can become complicated infections. And also we need to know whether the infection is from the lower urinary tract or upper urinary tract. Now, basically, if you look at these diagrams, any structures above the bladder, basically the kidney and ureter is considered upper urinary tracts, and the bladder and the urethra is considered as lower urinary tracts. Now, how common is urinary tract infections or UTI? Basically, the risk of getting UTI is about 50% over lifetime. Okay, so any of us here will have about half the chance of getting urinary tract infections, and as much as 25% of them will have a recurrence. Now, we all know urinary tract infections are more common in women compared to male across all ages, but as you age above 50 years old, the ratio for female to male actually decreases, which means the chances of male getting infection getting higher above the 50 years old. Why? Because above 50 years old, male might have encountered other problems. The commonest one is because of prostatic enlargement, resulting then the need of catheterizations or any urological instrumentations or surgery. So that increases the risk of urinary tract infections in male above 50 years old. But still, if you talk about ratio, the female to male is still higher in males. The only thing is that the ratio is going down. All right. Now, half the women above the 50 years old will have risk of infections, and as high as 36% of younger women reported at least recurrence in 1 year time. Okay, we have gone through this urinary tract system. So, what are the hallmark of symptoms? So, the commonest symptoms that one can present is actually painful urinations, frequency of urinations. So, commonly we see patients complain that they need to pee every 5 minutes, every 10 minutes, every 15 minutes, but when they go to toilet, only a little amount of urine or sometimes it just dribbles. All right, that's one common. Or urgency. They can't hold the bladder, they feel the bladder become discomfort or sometimes pain, but actually there's not much of urine in the bladder. And in severe cases, 10% of them will have blood in the urine. So basically, if someone presented with symptoms of this is called hallmark of the urinary tract infection. Usually it comprises the lower urinary tracts, right? But sometimes some people ended up with more serious symptoms, such as fever, nausea, vomiting, or even loin pain or flank pain. So if someone with presented with this kind of symptoms, we need to suspect that they might have a more severe type of urinary infections, more complicated type, and infections has involved the ureters or the kidneys. In severe cases, sometimes the patient can be very ill. They might be very dehydrated and the blood pressure may be very low. Okay, now in women who present 2 out of 3 symptoms of painful urination frequency and urgency without any vaginal discharge, almost 90% of them will have UTI. Now, why I say generally, just because sometimes some women, young women, they present as if they have urinary tract infection, but actually they have some other problems, for example, vaginal infection or any fungus infection. Now, what are the risk factors of you getting urinary tract infection? I'm going to show you this. Actually, this is according to the certain age group. So in women, young women, premenopausal women, commonest risk factors as most common is actually related to sexual activity. All right, new sex partner in the past 12 months definitely increases the risk of getting UTI. Multiple sex partners, all right, the use of spermicides, okay, and early onset of urinary tract infections, and also recent antibiotic usage. So sometimes some patients might have multiple visits to clinics, have been taking a lot of antibiotics, sometimes related to urinary tract, or sometimes taking antibiotics unrelated to urinary tract, but because of multiple antibiotics use and prolonged and recent use, so they are actually quite predisposed to urinary tract infection. In postmenopausal women, so risk factors include sometimes they have prolapse, okay, such as the bladder prolapse and all this, resulting them very difficult to empty the bladder. They have a lot of urine retained inside. So all this increases the risk of urinary tract infection. What about in men? Now, infection in men is generally considered more complicated, right? Because men hardly get urinary tract infections, but as I said, above 50 years old, the risk of getting urinary tract infections is higher. Why? Because at the older age, when it gets older, the prostate might get enlarged, all right? Urinary flow might be a problem, difficulty to empty the bladder, right? And as they age, they might have other comorbid, for example, diabetes, uncontrolled diabetes, all right? And the other risk factor is patient with immunocompromised, some patient with undergoing chemotherapy, all right? And sometimes elderly patients which has other conditions such as strokes or other neurological conditions which makes them paralyzed, they cannot move around, they might need to use catheter, or a recent surgery that involve genital urinary tracts. So all these increases the risk of urinary tract infections. Now these are the charts that I'm going to that I put up here. If you look at this is you can actually see the risk for male and females. Now basically young women and all the commonest cause is still related to sexual activities, whereas in men above 50 years old, commonest cause related to urinary tract outflow obstructions, right? But in children's, we have to be careful because in children's, most of the time we need to consider congenital problems or functional abnormalities problems. All right. In postmenopausal women, we need to look at the conditions that affect them after menopause. One common condition is because estrogen deficiency. Now, how do you work out for urinary tract infection? Basically, when you visit the doctors ask you a lot of questions. All right, they need to know, is this the first time you had your infections, or is it a recurrent infections? How many times you had infections? Over over the period, the durations? All right, is it complicated? Is it uncomplicated? Sometimes the infection might go off by itself. What are the precipitating factors? Basically, we want to work you up. We want to know what are the risk factors that contributes to the infections. All right, and we need to examine you. All right, examine whether any pain in the bladder or any pain in the abdomen. All right, sometimes by just looking at you, taking the history and examinations, we can make up our mind. So what are the possible causes for urination now of infection? Now, why is it important? Because sometimes there are other conditions that presents like urinary symptoms of infection, but it's actually not infection. For example, sexually transmitted infection can also present things like that. And also, we don't want to miss any cancer. Cancer in the bladder can also give symptoms like frequency all right, you keep going to the toilet, all right, and also blood in the urine. So these are the things that we don't want to miss, especially in elderly people, right? That's why a thorough examination is needed. So sometimes we might send the urine for analysis for culture. Why? Because it is important for us, especially if you keep having infection. We want to know what type of antibiotics are you susceptible with, or are you developing more aggressive type of bacteria which is resistant to a lot of antibiotics. Okay, now most of the times by just examining and taking history, we can actually make up our diagnosis, all right, but and that is actually enough. Sometimes with a simple urine analysis, there's actually enough for us to make up our diagnosis, but sometimes your doctor needs to do more tests, basically more tests like imaging, maybe an ultrasound or a CT scan. Why? When you keep having infections and not responding to therapy, or sometimes when you are having something else, for example, stones, when you suspect stones, or when you suspect something wrong with the bladder, all right, some neurological conditions that affect your bladder contraction and bladder emptying, okay, because we want to make sure there's no other things that contributes to this. And in men, because we know in men, urinary tract infection in men, in young men, is actually quite rare, but you're having it at a younger age, we need to know why. Is there any problem with the urinary tract or not? So in children, it's mandatory for us to assess the urinary tract because we don't want to miss any congenital or any functional causes. Now, how does the UTI happens? So basically, the bacteria gain access to the urinary tract from the urethra. It colonizes the opening of the where the urine flows out, the meatus, urethra. Then from there, it gain access to the bladder. It stays in the bladder. It destroys the bladder cells, and then it penetrates the bladder. Then from the bladder, it can follow the ureters and gain access to the kidney. So that is more severe form if you gain access to the kidney. It can cause conditions very known as pyelonephritis, and if you don't treat it, recurrent infection in the kidney can cause acute kidney injuries. So in female, because of the nature of the anatomy, all right, the meatus opening, the vaginal introitus, and also the rectum are all close by, and also sexual activity plus the microbacteria from the nearby the rectum, that makes it more easy to gain access to the bacteria, make easier for the bacteria to colonize the urethra and cause infections in the bladder, and then it might ascend move up to cause kidney injuries. Now, so when we talk about infections, we need to look at two factors. One, host factors, which means ourselves, all right, the human body, and second, the bacterial factors. So human factors, like I said again, we need to assess if there are any stones or not. Stones is a common nidus for infections, and then we need to check the patients, the host factors, how they empty the bladder, whether how much urine left inside after they pee. Are they in the group of high-risk patients, for example, diabetes or any immunocompromised patients, and any neurology, because it affects the bladder functions. And also, we need to look at the urinary tract if it is any blockage that cause outflow problems. So, what about UTI in men? So, in women. Now, in women, like I said just now, they have higher risk of getting an infection, particularly one because of the vaginal introitus, the opening of the urinary meatus, and the rectums all are nearby. And then number two, women have short urethra. Urethra is women is about only 4 centimeters compared to male is about 20 centimeters. So if a bacteria to colonize the introitus, then of course it will reach the bladder faster and easier in women compared to men. And second, sexual intercourse, sexual activities, okay, and then lack of postcoital voiding, okay. These are the things that affects what do you call this chances of getting recurrence in urinary tract infections. And spermicidal use is one of reason as well. But sometimes, most of the time, the women doesn't know whether whether they are present on spermicides or not, because most of the times the male partner they buy the condoms. Now, for postmenopausal women, estrogen deficiency is definitely one of the risk factors. Now, next we look at bacteria. So, in a simple, uncomplicated infection, the commonest bacteria that cause, we call it E. coli. Okay, now I want to talk about this E. coli because it's common bacteria that cause urinary tract infections. So this is how the bacteria looks like. Now, why is this bacteria so interested? Because if you look at this diagram, this bacteria have these structures, okay, that makes them easier to attach to your bladder cells. Okay, when it attached there, it destroys the bladder, it stays in the bladder, it replicates in the bladder, and it causes infections in the bladder, and then from there they can travel up to involve the kidney. Now, a lot of times, in those days, many years ago, we believed that urines are actually sterile, but nowadays there are some studies that actually shows that the urine is not sterile. This bacteria actually hides and stays in the bladder, but for some other reason they don't manifest it out. But if any of the conditions that favors the bacteria to replicate, then they can lead to infection. However, this is just being a theory. Okay, so having identified the risk factors among men, women, and children, so our next step is actually to treat and to prevent the infection. Basically, the treatment and prevention actually to identify the cause and risk factors. For example, if you got stones that leads to frequent infection, you need to get rid of the stones, not giving antibiotic every visit. All right, because there's no use if you keep giving antibiotic in a patient with when you know the infection is caused by stone. And in immunocompromised patients or patient with urinary tract obstruction, you need to clear the obstructions, and especially in male with enlarged prostate where they have difficulty in passing urine, they retain a lot of residual urine after each voiding. So in that case, you need to treat the prostate, all right, so that they can empty the bladder better. Okay, now 20% of women will have reinfections in 6 months. So how do you treat in a simple uncomplicated infection? Most of patients that visit the doctor, sometimes just from the history alone, that's suggestive for urinary tract infection, and the examination also suggestive of urinary tract infection. Simple, and as I mentioned, simple and uncomplicated. It is justified for the doctors just to treat based on the symptoms and also the examination. Not necessary we need to send the urine for culture. Now, when we send the urine to the lab for analysis and for culture, in men, in pregnant women, all right, in postmenopausal, basically these are all complicated cause of urinary tract infection. All right, so in this group of patients, we need to do more apart from just taking history and examinations of the patients. We need to send the urine to the lab for analysis and determine which type of bacteria and according to the antibiotic susceptibility. Now, antibiotics is the hallmark, the main mode of treatment for patients with urinary tract infections. So when you choose antibiotics, we always choose antibiotics that is excreted mainly through the urinary tract, with high concentration in the urine, and also antibiotics that target primary pathogens that causes urinary tract infections. Most of the times, a short course of antibiotics 5 to 7 days is enough to treat a simple infection. Sometimes you might need a longer course of antibiotics. In severe cases, some patients, especially in infections involve the kidney and the patient is unwell, sometimes they need to get admissions because oral antibiotic can't treat this condition. Sometimes you need intravenous forms of antibiotics. So These are the chart I'm going to show how long we treat a patient with antibiotic for a simple infection. Sometimes just a course 1 week of antibiotic is sufficient. But if you get recurrent infection again, then we need to send the urine. We need to check the urine whether is it the same bacteria or a different type of bacteria. So in that, or sometimes if you keep coming up with infection, we need to do more tests or more imaging to determine any other cause. So the other thing is sometimes you go for medical checkup and then you found bacteria in the urine, but you have no symptoms. You are perfectly well, no symptom, just incidental findings of bacteria in the urine. So in these conditions, do you treat or not treat? For me, simple. If you are well, you have no symptoms, you are perfectly well, you don't need to treat. But in a pregnant woman is different, because in pregnant women, if you don't treat, you have 30 to 40% of suffering more serious complications, especially infection involving the kidney, or high risk group of patients, patient going for urological surgery, or patient with any abnormalities of urinary tract. So in this group of patients, even though you have no symptoms, you might consider treating this group of patients. As mentioned, in pregnant women, even if it is you are asymptomatic but you have presence of bacteria, you need to treat. After you treat, every time you follow up at the antenatal clinic, you need to check the urine, or sometimes you need to give prophylaxis longer course of antibiotic even after delivery, because after delivery, presence of lochia and this can lead to increased risk of infections. Now, what about male? In male, the risk of infection is actually lower. So we treat all male with urinary tract infection as a complicated forms of infections. We need to assess whether is there a functional problem or is there any abnormalities to the urinary tract. So we need to beware of other conditions as well that presents like urinary tract infection in male, especially things like prostatitis. They can also give symptoms like infections or sexually transmitted infection. They could also give similar presentation as UTI. So what about patients on catheter? Basically, you see a lot of patients on catheter, patients on nursing home, patients in the ward, or bed-bound patients, those patients with neurological conditions such as strokes that they cannot be, they're on catheter. So this group of patients, they cannot tell you that they have infections. All right. So in this group of patients, you don't rely on the classical signs and symptoms. You look at the patient whether do they suddenly get unwell, do they have new onset of fever, all right, and you may have to ask the caretaker, is there any changes to the daily well-being, all right. From there, you might have to make a judgment whether this group of patients, do they have UTI or not. So if patients on long-term catheters, I don't advise them to do just a simple dipstick testing, because it will come out. Most of these patients will have a bacterial colonization, so the dipstick testing is not accurate. Now, sometimes if you go to the visit to the clinic, you get tested with dipstick test, especially patient on catheter, and the dipstick shows a lot of presence of bacteria or leukocytes in the urine. But you don't necessarily treat them. As long as they have no symptoms, you don't need to treat them with antibiotics. So another group of patients is a recurrent infection. Basically, if you have three infections in the year or 2 infections in the last 6 months, this is group as having recurrent infections. Usually, it is related to antibiotic usage. Right? Multi-drug resistance develops. Okay, in a younger group of patients, the main causes of recurrent infection is actually behavioral problem, sexual activity, new activities, use of spermicide. How do we prevent infection? I mentioned just now, antibiotics is the main mode of treatments. You can have antibiotics that is treated just a single course and antibiotic for 5 to 7 days and the infection settle. So in certain group of patients, you might need to give them low dose antibiotic, give them a longer period of antibiotics. Some might even end up with months of antibiotics. Okay, and also sometimes you might consider giving the antibiotics if they have if they know certain patterns when they have infection. For example, every sexual activity or every after menses they have infection, then you know there's a time if they have symptoms that you might want to treat them. But if you ask me, I am not actually in favor of giving long-term antibiotics. Okay, now a few reasons. Number one, giving long-term antibiotics, these are basically based on older studies whereby during that time the degree of antibiotic resistance are not the same as current. Now currently we have more types of bacteria that are resistant to antibiotic, multi-drug resistant bacteria. All right, and sometimes if you put them on long-term antibiotic and then suddenly you stop them, the UTI actually comes back. So it actually leads to nowhere. It is back to square one again. So some patient has been taking antibiotic for a long time, and then when the UTI come back, they visit another doctor, and the doctor continue the antibiotics again. So for the whole year, for the next few months, they keep having antibiotic over and over and over again. So it actually is more risky. Risk of developing drugs resistance is very high. So for me, I'm not really in favor of long-term antibiotics, and perhaps it's not a wise strategy at all to continue antibiotic. But having said so, there's one caveat. Some women experience infection after intercourse. So in this group of patients, yes, maybe it is wise to consider antibiotics after intercourse. So what are the we seriously actually need to consider reconsider use of long-term antibiotics, because not every patients are suitable for that. We need to assess individually based on the condition, based on the comorbidities. Now, other than antibiotics, is there any options? Yes, of course, there's always options. Number one, which I'm favorable, is actually non-antimicrobial behavioral modification. So if you know the risk factor, you reduce the risk factors, okay, especially sexual practices, number of sexual partners, multiple partners, okay, and then void, you pee every time before and after intercourse, good bladder habits, try not to hold the urine for too long, practice good hygiene, and also hydration. Drinks a lot of waters. I'll come to that later. And the other thing is, what about douching? Now, some patients, they, in their opinion, they thought douching can actually cleanse the vaginal, and then it leads to reduce incidence of urinary tract infection. But in fact, douching actually will disrupt the pH in the vaginal. It will disrupt the normal bacteria, the balance between the good and bacteria, and it causes more risk of getting UTI. All right, so douching is actually not advisable. Now, what I mentioned, all these, they are not really evidence based. Some of them are not evidence based, but it does make sense. Just now I mentioned about water. A lot of times doctor likes to ask the patient to drink more waters. These are the things that we have been talking for years and years, but are there any evidence? Yes, in 2018 someone actually do evidence whether water increase in water intake actually reduce the risk of getting UTI. So there's a study that shows that all these are among patients with proven urinary tract infection, and this group of patients, we ask them to drink extra 1.5 liters of water compared with the one with the normal intake. Now, just by getting extra 1.5 liters of water, it reduced 50% chances of UTI. So now we can tell the patients with scientific and confidently that drinking water can a lot of water actually prevents urinary tract infections. What about supplements? Things like cranberry. Now, cranberry are easily accessible by over the drugstores supplements. It prevents the adhesions of bacteria, okay, to the bladder wall. So cranberry has been sold in many forms in drugstores. Some of them are in juice, extracts, concentrates, capsules. All right, it is supplement and it is not regulated. So a lot of times people ask me which is better, whether the juice is better or the extract or the tablet form is better. I cannot tell them which one is better because it is hard to draw conclusion because all of them are different. Now, cranberry is the component that actually not only have sorry, the contents of the cranberry is actually not that important. All right, the most important is the chemical content of proanthocyanidins, or we call it PEG. You need to have a minimum of 36 milligram of PEG in the cranberry, then it is considered to be effective. So if you go to the drugstores, you get a cranberry tablet or extract or juice. Sometimes it's written there you have 1000 or 5000 or 500 milligram of cranberry. That's basically irrelevant. Okay, the most important thing is you need to look at the content of the PAC, the proanthocyanidins. So these are the things that apart from cranberry, this compound is also available in grape seeds. But unfortunately, most of us like to eat seedless grapes. Okay, what about other component like vaginal estrogens? Okay, it reduces local pH. This is very useful, especially in postmenopausal women, because it promotes the growth of lactobacilli. It restores the vaginal flora to premenopausal state. So it actually reduces the risk of getting infection. It is not a form of treatment, but it reduces the risk. Other than infection, estrogens, cranberry, other supplements that you can easily get is actually D-mannose and also probiotics, easily available in any drugstores across the country. Now, if you ask me which one is better, which brand is better, is this better, cranberry better, or probiotics is better, I cannot tell you which one is better. All these are just supplements, but it is not harmful. All right, it's not harmful to take this, and in fact, you should try every methods of non-antibiotics method before you go to taking your medications. Okay, with this, I would like to end my talk. Okay, thank you. So I have a question. This is about a 14-year-old boy with positive urine test from the dipstick test in the clinic has given the two courses of antibiotic. Now, like I said, in children's, it is different. We cannot treat children's like small adults because it is completely different. We need to know if really it is a recurrent infection. We need to know why it's having recurrent infections, and ultrasound done, and it shows perhaps it shows everything is normal. So we actually needs to interview the child, need to observe how the child behave, their avoiding habit and all this, and we might need to know their what to call this their drinking habits. Okay, so we need to get more history. It's very difficult just to answer based on the ultrasounds and also the antibiotics and also the dipstick test, because in children we need to see how frequent they have. We need to see the voiding habits as well. All right, sometimes they have conditions in the some bladder, other condition, other neurological conditions that cause recurrent infection. And sometimes is if the abnormality is not severe enough, it might not show on a simple ultrasound. All right, in this sometimes we need to do more imaging. We need to do imaging during the maturation when they pee, so that we can know further. Okay, we need to know for more further investigation rather than just a simple ultrasound. Okay, thank you.